It's important to acknowledge that although your selected treatment is an elective surgery, there are, as with any surgery, risks and complications you need to be aware of. The complications that can occur during the surgical procedure include excessive bleeding, blood clot formation, and adverse reactions to the general anaesthetic. There are also complications that can occur after surgery which you should be aware of. Infections can be quite problematic and have to be taken seriously if they occur. If you are affected, it would become apparent over the first 2 to 3 weeks after surgery. A mild infection, such as a wound infection, would settle down with antibiotics. And of course, the package price you pay for your breast reduction will cover the cost of dealing with any infection. Internal bleeding is another potential complication. This usually occurs immediately after the operation, but can very occasionally happen up to 2 weeks later. If there is bleeding present, your breast would become swollen and tight, and you'd need to return to the operating room for further surgery. You're likely to spend an extra night in hospital, and you might be a little bit more bruised than expected, but everything should settle down over time, and it's unlikely to affect your final result. After surgery, it can be quite common to experience some alteration in breast or nipple sensation. This usually presents with either an increased or a decreased level of sensitivity around the scar and the nipples. In very rare cases, the surgery can result in the complete loss of nipple sensation, but choosing a highly skilled surgeon will reduce the risk of complications occurring. In most cases, however, numbness and oversensitivity are temporary and they gradually settle down over time. Another thing to be aware of is an issue known as bottoming out. This can occur when the lower half of the breast tissue naturally droops down into a teardrop shape, whilst the nipples stay in their place, and it may make the nipples appear overly high. The extent to which this happens depends on how much breast tissue there is and how heavy it is. It's most commonly seen when an inverted T and inferior pedicle technique are used together, but it can be corrected with further surgery. As breast surgery requires incisions to be made, minimal scarring is unavoidable. In most cases, however, the scars are relatively mild and they'll become really thin and barely visible over time. Although, unfortunately, scars are unavoidable, there are many scar-reducing techniques that can be found in the post-operative guide we will send you prior to your surgery. It is sensible for you to be aware that there's always a risk you're not satisfied with the aesthetic result of your surgery. You may be unhappy with the size, shape or symmetry of your breasts, and it's for this reason we advise patients to choose their surgeon so carefully. Make sure that he or she fully understands your expectations and desires. It's therefore important to be candid with your surgeon about the results you want. We try our best to help with this by ensuring that your surgeon is a highly experienced BAPS or BAPRAS member. Your surgeon will be able to discuss the risk of developing all these complications with you in further detail during your consultation. During a breast reduction, breast tissue containing milk ducts and milk glands have to be removed in order to reduce the size of the breasts. Because of this, your ability to breastfeed after surgery may be affected. Many women are still able to breastfeed after a breast reduction, but this depends heavily on the tissue removal technique chosen by your surgeon. The techniques will impact on your ability to breastfeed to varying degrees. You should therefore notify your surgeon if you are planning to breastfeed in the future, as they can advise you which is the best procedure for you.